Hey guys, welcome to my channel, Medical Assistant with Miss K. My name is Kendra, aka Miss K, and I'm a medical assistant instructor. And today I'm going to be talking about how to confidently teach, lead, and thrive in the classroom. Okay. Now, I decided to do this video because I found myself training a new instructor, a brand new instructor. She was brand new to teaching. And I said, you know what? Let me actually make this into a lesson so I can help other instructors as well. And also going forward, this is probably something I can just show to newer instructors because I'm going to be saying the same thing every time anyway. So I said, let me just make this into a lesson. Okay. So this is for new MA instructors. So if you're brand new to teaching, whether you are a, medical assistant, a certified medical assistant with experience, or you're a nurse or doctor, because nurses and doctors also teach medical assistant as well. I've taught with nurses before, and I've also taught with doctors. So any MA instructor, whether you're a clinical MA and you're transitioning into teaching, you're already a teacher, already adjunct faculty, or maybe you're a lead instructor in training. You're the lead instructor and you're responsible for training other instructors. This will be helpful to you too. So this is really for anybody who is preparing to teach or already teaching. And just a little bit about me. Again, I mentioned my name at the beginning, but again, my name is Kendra. My students call me Miss K. I became a medical assistant in 2004 and a medical assistant instructor in 2011. Okay. Also, I help with exam prep. I work with different schools and I help with preparing their students for certification. I also do it here on YouTube. If you're watching this video, you came across my YouTube videos. Maybe you're already subscribed. If not, you can go ahead and do so. I also consult with different schools just on curriculum and different things and how to better their program. And I'm also an entrepreneur and creator. So in addition to being in the medical field, I have several businesses and I'm also a content creator. So do me a favor, guys. Let me know in the comments where you are in your process. If you are a new instructor, are you a medical assistant? You're thinking about teaching. Maybe you're a nurse and you're thinking about teaching. Let me know where you are in your journey right now, and also let me know where you're watching from. Now, I do want to mention my MA refresher course. Now, this is for students that are preparing for certification. This is also good for anybody who has been out of the field for a long time and they just need a refresher, or for people who have worked as a medical assistant but never went to school and they need to get certified. And this is for you. It's an online study guide. And if you are an instructor and your students need to prepare for certification and you want to get them signed up for this, you can always sign up to be an affiliate if you want to earn some extra income. I have a lot of people who signed up for my affiliate program and they get commission whenever someone uses their link to get the course. So how it works is you sign up, you get your personal link, and as people sign up using your link, you get a commission. So if you're an instructor and you sign up for the affiliate program, send me an email. I'll leave that down below so that way I will know you're an instructor, because instructors, I usually give a higher commission. When you sign up, it's going to default to 10% commission. But if you're an instructor and you're going to be referring your students, send me an email. Let me know, hey, Ms. K, I signed up from your video as an affiliate. I'm going to refer my students and I'll give you a higher commission. Okay. And I do want to make sure you know that if your students are taking an exam like the CCMA or the CMA, AAMA, or the RMA, they will get the clinical course. Okay. That includes both clinical and administrative. And then if you have students that are taking administrative certifications like the CMAA, then they will sign up for the administrative course. Okay. They don't need both. Some people make the mistake of buying both. They don't need both. Okay. So that's marefreshercourse.com. And I'll also leave that link in the comments. Okay. All right. So let's get into it. Now, the first thing I want to talk about is the mindset shift. So there is a mindset shift that you have to have because, when you're going from clinician to educator, whether you're a medical assistant, nurse, doctor, when you are becoming an educator, you do have to have a mindset shift because it's not just about you anymore, right? Of course, it's always been about your patients, but when it comes to doing your job, you may be the best at it. You may get all types of awards. Your colleagues love you, the patients, providers love you, but that doesn't always translate to the classroom as an instructor. Okay. Because you have to remember that you have to teach, you have to explain why you're doing what you're doing. I remember when I first started teaching, and I was very young, I was like 25 years old, very young. And I just remember before I started teaching, I was working in a lab, so I'm drawing blood all day. And when I started teaching, I was teaching the phlebotomy module. I'm so used to just drawing my patient's blood and not explaining, okay, this is what I'm doing next and this, that I had to remember to do that with my students. So I want you guys to remember that, like, you're also explaining why. Okay. Also think about the fact that you're shaping future professionals. This was one of the biggest things I was looking forward to when I became an instructor, is because I'm very big on professionalism. I believe in treating patients the way I want to be treated and the way I want my loved ones to be treated. So I was excited about the fact that I get to shape the future medical assistants. And even today, like, I teach my students to be as professional as possible. Of course, they're going to do what they do when they leave the classroom, but in my classroom, I am setting you up for success. I want you to be as professional as possible, because I know that you are our future, especially when you get those young students. You guys know the youth are our future. I've had students as young as high school age, and that's our future. And so you got to keep that in mind too. And you also want to keep in mind that you're a role model now. Now, I have another slide later where I'm going to talk more about this, about setting an example, but you want to keep that in mind too, that people are looking up to you. Your students, they are going to naturally look up to you. Your experience, they're going to respect you just because of your experience. And they're going to look to you as an example. So think about these things as you are transitioning into becoming an instructor, or thinking about it, that again, you're no longer just going to be doing, you're going to also be explaining why. You're shaping future professionals. And then remember, you're a role model. All right, classroom basics. Okay, classroom management basics. Okay, listen, I mentioned I was very young when I started teaching. I was 25, very, very, very young to be teaching medical assistant. Most of my students, they were my age and older. I had students older, actually older than my mother's age in my class. So I was very nervous, but I noticed that those students that were old enough to be my mother, they respected me more than the younger students. But establishing authority early is very important. Okay. Your students should look at you the same way we look at our bosses at work. There's just certain things that we are not going to say or do to our boss or around our boss. And the students should have that same respect for you. So from day one, you want to establish that authority. You want to talk about classroom expectations in your very first class. So usually when I get a new class, we go through introductions. I introduce myself. I let them go around and introduce themselves. And then we go over expectations. So some of the things you want to talk about now, your school, some of these things I'm going to talk about, your school probably already has a policy on these things. Maybe you set your own policy, and then maybe, if they do, you want to just reiterate them. So some of these things, my school enforces, and then I reinforce it when they come into the class. And one of those things is going to be dress code. So make sure your students know they need to be in scrubs, right? Certain shoes are not allowed, certain headwear, dress code also includes, being professional as far as like piercing. So if they have facial piercings, which facial piercings need to be removed, and again, your school may have a policy on this, but I strongly enforce it in my class. I know that, times are a little different today, and a lot of places are not as strict when it comes to covering tattoos and, hair color and things like that. But as long as, the hair is pulled back, hair should be pulled back. It should be neat, right? Hygiene is something that I do talk to my students about, but I set my students up for success. So we're going to be as professional as possible. So we're covering up tattoos, even if they don't require it at every office now. We're going to remove facial piercings, the big facial piercings. I forget what the piercing is in the nose that it hangs out. I cannot think of it right now. And I just thought about it earlier and I can't think of it right now, but I make them take that out in class, or they can, turn it around. There's a way that they can turn it around so it's not as visible, nails, of course, that is actually a policy that nails can't be but a certain length. So you want to talk about those things. Also, language. My school, we don't allow foul language, profanity at all. So you want to talk about that. What are the consequences to that? Are students written up? Do they get a verbal, a write up, and then more serious um disciplinary action? So it just kind of depends. Also, the attendance policy, you want to talk about that. What is the attendance policy? So I know with my school, they can't miss more than 5 days in class, and every three tardies is an absence. Okay, so if they're late 3 times, then that's one of their 5 days there. So you want to reinforce that on the first day, the importance of being on time. I know at my school they would lock the door after a certain time, so make sure your students know to call you or email you when they're going to be late or they're absent, because they want to get into the mindset of what they would do at work. They're not going to just miss work and not call their boss. That's a no call, no show. So if you're not going to be in class, I expect an email. If you're running late, I expect an email, not to, send a message through your classmate. Let me know directly, not through your classmate. Let me know directly. Also, the expectations for missing assignments and missing tests. So again, your school may already have a policy and you may have one of your own for your classroom. So for me, late assignments, points are taken off, and then after a week they're not accepted at all. So you can decide what your classroom policies are. I'm just giving you some ideas, some things that I do. And then also tests and quizzes. If a student is absent on the day of a test or quiz and they have a doctor's note or something that was pre-planned, we've already talked about, they can take it. But if it was like a pop quiz or just a quiz or a classroom assignment and there's no excuse, they just weren't there, they didn't feel like getting up for whatever reason, then they can't make that up. So again, you can decide how you do that in your class. And the reason why you do that is because you want to set that expectation, because if you don't, then they will, kind of run over you. And we do have to remember that they are adults. These are not children. So you don't want to be so hard and so like, you want to be reasonable, right? Because a lot of people, they have jobs, they have kids, so you do want to be reasonable, but at the same time, you got to have those boundaries there. You have to set that expectation, because if you don't, people will run over you. It's just human nature. Professional boundaries, again, they're adults. It's okay to be friendly and be playful sometimes, but they have to have that respect for you. You have to, you, if you lose that respect, you'll never get it back. And you get that respect and you keep it by being consistent. When you waver, and they kind of know, especially when you get the younger students, I used to get students that were like fresh out of high school. Now those students that's fresh out of high school, they will really try you. Okay. So you really got to be consistent. So whatever your expectations are, you have to be consistent with reinforcing it, because if you don't and they see you waver, they're going to know that they can get over on certain things. Okay. All right, let's talk about lesson planning. Okay. So when it comes to lesson planning, I'm going to be honest with you. When you're starting out, the most work that you're going to do is in the beginning. Okay. Because you're going to need to familiarize yourself with the lessons that you're going to be teaching. Now, and a lot of this information you probably haven't seen since you were in school. So you're going to be doing a lot of reading and a lot of studying early on, because you want to be prepared for your students' questions. Now, there's going to be some things you just don't know. I usually tell my students from day one, listen, I don't know everything. So if you ask me a question and I don't know it, let's try to figure it out together, because listen, I work with doctors. Even they need to look up certain things. Okay. There's no way for me to know everything, but you do want to be familiar with the lesson. So there's some things that you're just going to have to know. Okay. When it comes to certain lessons. So I recommend once you get your textbooks and your materials from your school, to read over it, whatever chapters you're going to be going over, make sure you read it, make sure you familiarize yourself with it. Okay. And one of the best ways to, because one of the questions that the instructor had that I was recently training is that, how do I know what to teach? Now, most schools, they're going to give you a syllabus. Okay, they should give you a syllabus. I don't even want to say they probably will, or they may, they should be giving you a syllabus. Okay, and maybe even an outline. So my school, we have a syllabus and we have an outline. So every day there are certain things that the student must be learning, certain things that the student must be doing. Okay, now the outline, depending on your school, you may can kind of do your own thing. You may not have to follow it um, day by day, word for word. They may give you some autonomy with that as long as the student gets everything on it. So that just kind of depends on your school. But as far as, the syllabus, you want to look at objectives. So what objectives is your student supposed to be meeting, right? And you can kind of use that as a guide. So you're going to have objectives in your syllabus and in each chapter. So as you're going over, so let's say you're going over the medical terminology chapter, right? And the objective either on your syllabus or maybe in the chapter, I'll give you an example. Student must be able to, this is an example of an objective. Student must be able to identify medical terms for each body part. So what you want to do to make sure that they meet that objective, you may assign them to make flashcards. Okay, so they need to make flashcards of every single body part. On one side, they're going to have the medical term for that body part, and on the other side, they'll have the actual body part. Okay, and then you can maybe eventually give them a quiz from that. So that's an example of using the objectives. So whatever the objectives are that are listed in your syllabus and the books, you want to just make sure that you are assigning them lessons from those objectives and also quizzing them to make sure they meet it. So that's like the best thing, honestly. If you're making sure they're meeting those objectives, then you're making sure that they are getting what they need, and follow the outline. So I mentioned that you can probably kind of, do your own thing as far as the outline. However, when you're just starting out, I know for me, when I started out, I followed the outline to a T. Okay. I did everything it said from day to day. And then as I became more comfortable teaching, I said, you know what? Well, maybe I don't need to do, phlebotomy first. Maybe I want to do EKG first, so just things like that. You'll just kind of notice that you can kind of change it around. Like for an example, with my program, EKG comes much later in the course. However, when we're doing, learning vital signs, they're learning pulse and respiration. When I noticed that I had a student who had an arrhythmia, we were checking her pulse and I could feel it. I said, oh, we need to start EKG. I said, we need to do the EKG on her. So we did it much earlier. And this was like maybe week 3. And even though we didn't normally do EKG until week 9, when I noticed there was a need for it, I said, you know what? Y'all learning EKG today. So it's okay to kind of, if your school is okay with it, it's okay to kind of go out of order. And again, that's going to come with experience. As you get more comfortable, you'll be okay with, just kind of doing your own thing. But again, the most work that you're going to do is going to be in the beginning when you're getting, you're just getting started. Now, when it comes to lectures, you want to make those interactive. You want to ask questions. So, and that's why I don't even want to make this video too long, because adults, they say kids have low attention spans. We adults are even worse. So you want to make it interactive. You want to ask questions, and you want to make sure your lectures are not too long. You do not, if you have an hour-long lecture, you need to have breaks in between. You need to have you need to ask questions. One of the things that I even do, I even let my students pick a lesson that they want to teach, and I've even let them teach a lesson. Just keep it interactive. We play games, and I may do a separate video on some different games that I've done, but we have Kahoot. That's a good game. Jeopardy. Just make it fun and interactive, because when you have adults are different from children. Like I said, they have a low attention span, but adults have real problems. Adults have jobs, they have kids, they have bills, they have real worries and things that they're thinking about. They don't have to be there. And so you really want to try to keep their attention just by keeping it interesting. Okay. And then I'm going to talk about demonstration and practicing in the next slide, when we talk about, clinical teaching clinical skills, but also assessment and reviewing. So assessments is just referring to like your, like your tests and quizzes and assignments. This is how you're going to assess that your students that they're picking up the information. Like tests and quizzes are not just to have something to give your students. They're really there to assess how they're picking up the information. Okay. All right. So when it comes to teaching clinical skills, now I know for my course it's accelerated. So it's 12 weeks. So I always have my students to watch videos. Now I have some clinical videos on my channel. So I will have them watch my videos. If I don't have a video on a certain skill we're doing, I'll find one on YouTube and I'll have them watch it before we do it in class. I always have them watch it like a day or two before we do it in class because I want them to become familiar with it, especially since it's an accelerated class. I want them to already have an idea of what they're going to be doing. So that's always that's always an idea for you too. So show them videos. You can show them in class or you can assign it for them to watch it at home before class. Okay. So when it comes to demonstrating it, you want to just, go slow and you want to explain it. Okay. You want to make sure you are explaining what you're doing. Again, I mentioned that in the beginning. It's so easy to just do it because you're used to doing it, but you want to explain why you're doing it. And then you want to just go slow. Okay. Make sure you are, make sure that everybody is kind of gathering. Actually like this picture that I put on the slide here. You want to make sure that you have students, just kind of around. Actually, when I'm teaching EKG, I do this very thing. Instead of me just putting the electrodes on the person we're demonstrating on, I actually have them do it with me, even though it's their first time. I have them do it with me so they can kind of get a feel for it, and then I have them pair up and do each other. So you want to do real world, have real world scenarios where you're telling them about certain things that you experience. Show them videos, okay? And then if the course is accelerated, you may not be able to practice repeatedly, but at least let them practice a couple times. Like something like EKG, once they do that 2 or 3 times, usually they're pretty good. What I spend the most time on, usually because my program is accelerated, I spend the most time on vital signs, specifically blood pressure, because that's what they struggle with the most. And then also phlebotomy. So I think those are the two things that I spend the most time on. Your program may be different. So I've also worked in schools where students, they come to me for different modules. So maybe I may only be doing the phlebotomy module, or maybe I'm only doing the EKG module. So if your school is like that, then of course you won't be doing everything, but just again, show videos, demonstrate it slowly, explain everything. Of course, you want to be safe. Okay. If you're doing phlebotomy, make sure they understand how to properly discard their needles, how to safely recap an unused needle if they're drawing up, medications. You guys are doing injections, they're drawing up medications and they're not using it yet. So make sure that you are, referring back to real world scenarios. Like, what do you do in the real world? Don't get caught up in being in the classroom, because one thing I have noticed that too is that students, and even instructors will get caught up in the classroom because it's the classroom, but you can still get germs. You still need to wear your gloves. You still need to discard everything appropriately the way you do in the field, so just keep that in mind as well. And then of course you want them to practice. Okay, so let's talk about some difficult students. Okay, so this is just bound to happen. I'm not going to say if, it's a matter of when. Okay, it just is what it is. It will be nice to have a perfect class, but that's not realistic. So let's talk about some of the difficult students you get. So you want to get the talkative one, the one that just will not be quiet. Okay, you may get that one. So with that type of person, you want to just kind of, acknowledge their participation. Like, oh yeah, you know what? That's a good point. You know what? Let's try to hear from someone else who hasn't spoken yet. That's how you can kind of redirect, or you can also set like time limits on certain responses for sharing, then you have the unmotivated student. You may have that student where, they're notice that they're not engaged. Maybe, they're late with turning their assignments in. They just seem like they lack an effort. They're lacking effort. You want to just kind of have private conversations with them. You don't want to embarrass them. You never know what could be happening. It could be some family issues, could be work. I have some students that work overnight, could be their confidence, maybe they're discouraged and not confident in their ability. So you want to kind of talk to them offline and refer them as needed. So your school should have some kind of department where students, like for an example, I had a student who was sleeping in her car, and I had to refer her to, our that department at my school is called student success. And so they can help her with certain things that I can't help her with. Okay. And then you got the late student. We talked about attendance in the beginning. So, you may have to write them up. Again, at my school, 3 tardies equals an absence. So reiterate that policy to them. If your school's policy is locking the door, they won't be able to get in. You know what I mean? And then decide what the disciplinary action is. Is it a verbal write up? Whatever that is. And also remind them and emphasize to them how it is in the real world. They can't just arrive late to class every single day. They can't just arrive late to work every single day. So reiterate to them. Then you got the students that just think they know it all. I've had students who thought they knew more than me and they wanted to teach the class. And so you want to, definitely validate their knowledge. Like, you know what, you're right. That's good. That's one approach. But then let's also look at this. Let's look at the standard protocol. This is one way to do it. But let's look at, let's see what the book says. You just kind of want to redirect them. And then also you can utilize those students to help you. Sometimes you do have some students that have experience in the field. You can utilize those students. You kind of want to play into their strengths, because their strength may be that they do know a lot of it. They've been there. I get some students who have experience. Maybe they went to school years ago and they're doing a refresher or whatever the case is. You just kind of want to redirect them to helping other students, and they love that, especially a student like that wants to, help and they want to put it out there that they know it. You can kind of utilize their skill in that way. And also with them, also just make sure you kind of, keep remind yourself that you're the instructor. So it's okay to, yeah, that's good that you know it, but you're the instructor. And so you don't want anybody to take over your class, and you can do that in a calm way and professionally, but don't let anybody take over your class. Okay. Then you got the anxious one. The anxious one may be insecure. They may be afraid to perform their skills or answer questions. So you just want to always normalize their mistakes, and it's a part of learning. So I do that. So I do a lot of lives where I'm going over study material. And sometimes when students are getting the answers wrong in the chat, they get discouraged. And I just remind them, listen, this is why we're doing this. I always say, this is why we are in class, for you to learn. This is why we practice. If I notice that students are hard on themselves, because maybe every time they draw blood, they're not seeing any blood. I just remind them, this is why you're learning. You're brand new, give yourself some grace. So you kind of want to do that. Okay. And then you may want to give those people, those students, maybe some extra practice time. Like sometimes I would stay after class. Sometimes I would come in a little early, so that's an idea as well. The disruptive one that wants to interrupt you, sometimes you'll have that. They want to interrupt you, maybe whether it's talking, trying to disrupt you talking, trying to talk to you or other students, side conversations, maybe they're on their phone. You want to address that immediately. You have to stay on that, because those are the type of students that if you do not stay consistent with them, they will run over you, or at least try to. Okay. Again, that goes back to discipline, verbal warning. And one thing I will mention, you want to document every single thing. Okay. That was one of the things that I did not do in the beginning. I'm better with that now, because I noticed that if you don't document, and then if something happens and you say to maybe your dean or your program director, I've been having this problem with this student all of this time, they're going to say, well, where's the documentation? Why didn't you ever tell us? Okay. So you want to document when you're having these type of issues. And that's one thing I didn't mention, phone usage. I didn't mention that in the classroom expectations, but you do want to have an expectation about that. I always tell my students, listen, I know we're all adults. Some of you have kids, so I don't mind you having your phone, but please don't scroll, especially when we're doing lecture. When I'm teaching and you on your phone, I have sat down. I'm like, you know what? Nobody is listening. I will sit down. And then they get mad when you do that because they like, no, don't. But I'm like, listen, you're not paying attention. I don't have anything to say, So um with the phones, you definitely want to address that, and you want them to know the consequences of that too. So I'll say, if you have a phone call, you got to step out, just let me know. Just don't be scrolling when I'm teaching. That is a big pet peeve of mine. If I'm teaching and you're not paying attention, oh no, I am not about to be talking to nobody. I will sit down so quick. um and if it's excessive, I will give you a verbal, and then I'll give you a written, actual written write up. And then you have students that are struggling. Okay, could be academic struggles. Maybe they don't do well on tests and things like that. So sometimes you do have to. Sometimes as instructors, depending on your school, usually they'll give you like some administrative time, and they may expect you to tutor those students during that time. And if you have a student who has a learning disability, that's another thing that you'll have to address with your dean at your school, or your student success department. So I don't want to get into that too much because that process is different when you have students with disabilities. I know when it comes to certification, like NHA, they will give them like accommodation to give them extra time. But when it comes to, the classroom aspect of it, of learning, that's going to be different. And you're going to have to it just kind of varies by school and by program. But one of the things you can do is some remediation plans. You're just going to have to spend some extra time with that student, try to figure out their learning style. And then I usually have students to figure out how to explain to me. And if they don't know, then they're going to have to try to figure out how they learn best, because I know flashcards don't work well for everybody. So I sometimes have students that will, give your notes to somebody at home, to your friend or your kid, if you have a grown kid. Because again, I get a lot of older adults, or your mate, your spouse, and have them quiz you from those notes, and so just try to help them identify their learning style. And then again, talk to student success and the dean. And then you want to be in regular communication with those type of students, regular check-ins, and you want to just be, you want to just monitor their progress consistently. And then you have students that want to try to cross boundaries, right? The personal boundary crosser. They want to say, girl, don't girl me. I'm your instructor. It's Miss K. I'm not your girlfriend. I'm not your sis. Okay. You got to set that boundary. So you want to, redirect the conversations back to the course content. When they want to, get too close, you want to call you nicknames, or they want to overshare, or, become too familiar with you and get into your business. You know what I mean? They want to redirect the conversation. So Miss K, you single? What you got going? I'm guys, I'm just using an example of what I get. What you, girl, you got a man? What you, I've had students like, listen, I'm not going to go there with you because this boundary is not going to be crossed. You are my student. I'm your instructor. We are not going to get into that. We're going to get back to this content. Now, and I do have times where we have free times and we may talk about certain things, like there may be certain things happening in the news. And sometimes we just have time to just kind of talk about something outside of medical assistant. We do that, but we're not going to get into my personal business. And I try not to let them overshare too. I don't want to know too much of their personal business either, because I don't want to cross that boundary. Okay. One thing I didn't mention, now that we're talking about boundaries, I did not mention in the beginning when I mentioned, boundaries. Don't let your students have your personal number. I know I will say this is a personal choice, but I did this a lot. And I will say, I do like that. I do get some students from years ago, because I have students that still literally from like 2011, my very first class, that still reach out. So I'm glad that we do have that. But looking back, I would have got a different number sooner. So if you can do like a Google number. If you have a Gmail, you can get access to Google Voice and you can get a different number. or just communicate via email. Because if something ever happens and they say that you've been inappropriate, and then they have to go through your text messages with that student or emails, if you keep it separate from your personal information, you never have to worry about the school having to look through your personal messages and all of that. So just keep it professional. They can easily monitor email and all of that, but just try to keep your communication strictly on either school email or maybe via like the GroupMe app or something like that. Okay. And then I just want to reiterate, when it comes to the difficult students, just want to reiterate that they should have the same respect for you that they have for their boss. Okay. And if it's, you've tried everything you can do and you're still having issues with certain students, again, refer them to the dean, student success, the program director, whatever that looks like at your school. Certification and exam prep. So if you haven't already, I definitely recommend, if you're going to be teaching medical assistant, find out what exam they're going to be taking. Well, you're going to know anyway. Once you find out, I recommend getting the study material for that exam and taking the test yourself. I do, because then you're going to know what's on it and you'll be able to prepare lessons for that certification. Okay. Because one of the things I will say, there are so many programs that do not, I repeat, do not prepare these students for the certifications. The curriculum is nothing like what's on the test. I recommend you to become familiar with what's on the test right away, so that way you can, efficiently, I should say, efficiently, accurately, effectively prepare your students for the exam. Okay. Take that test. Some schools, I know the school that I'm at now, I became a proctor. So I have access to the study material. So I was able to, go over that with my students. We go over practice questions together. I was able to create my own practice questions from having access to the study material. And so it just kind of depends. Your school may make you a proctor, or you may have to get the material yourself. Whatever the case, make sure you get familiar with that exam. Give your students some test taking strategies. I have some on my channel under study tips, so you can refer your students there, or you can look at it and then use the tips that I give and go over those with your students, come up with practice questions. And you don't have to worry about certification from day one. I will say that you don't want your students to get overwhelmed, but you do want to make sure that they know what's going to be on the test. And the way that you do that is by you knowing what's on the test. Okay. All right. Professionalism, you must model communication, appearance, punctuality. You cannot, use foul language and then tell your students they can't. You cannot not communicate and expect your students to. Okay. Everything that we said that we expect from our students, we have to demonstrate that same behavior. Okay. We can't say students can't be late, but then we're late every day. I see it. Trust me, I see it. I try my best. I'm adamant about not being late, because I don't ever want my students to think, oh, you're late every day, why can't I be late? No, I'm not giving you anything to talk about. Okay. So just remember, the same professionalism that you are expecting from your students, you must demonstrate yourself. Okay. Burnout prevention. So it's going to be very important for you to have time management. Okay. So when you are starting out, again, that's when you're going to do the most work. As you are, getting more experience, you're going to have old lessons that you're going to reuse, especially if you are using like an online system like Blackboard or Canvas. You're going to be able to just, every time you get a new class, you'll just be able to copy the class and use the same thing over. That's going to be the most beautiful thing. So that's going to help with your time management, but you want to utilize your administrative time. So if you get 2 hours of administrative time, utilize it. If you get an hour, whatever that looks like, use that time to, check tests or check assignments, whatever you need to do, grade assignments, come up with a lesson. Use your time wisely, because you do not want to get burnt out. When I first started, I was up all night, just I made life harder myself, because I didn't have organization. I didn't have a plan. So you want to have a plan. You want to set from day one. Okay. And one of the things I will say, if you set your class up in weeks, so if you go week 1, week 2, and decide what you're going to do each week, that's going to be such a game changer. Okay. Because if you try to look at the entire program and this is what I'm going to do here, no, go week by week. It's going to make such a difference. Have a plan. Okay. So for this week, all right, we get 4 days in a week. Most medical assistant programs is only 4 days. If you get 5 days, that's a little different, but most I've seen is 4 days. You're going to say Monday, we're going to do this. Tuesday, Wednesday, you go by that and you stick to it and just, plan it and stick to it. Your boundaries, that's going to be so important. Again, I mentioned that a few times. Keep your boundaries with your students. And also work. Work is going to come home with you sometimes, especially in the beginning. But then once you get your flow, once you've taught a few times and you get your flow, work stays at work. Okay. Self-care, get your massages, get your nails done, your hair done, whatever that looks like for you. Go swimming, go work out, whatever that looks like for you. And don't take student behavior personally. I told an instructor recently, it is not you. You're doing everything you can do. However, it is not you. You can't save everybody. Now, some students, you're going to have some students that's just, you know, put it like this. And I say this to everyone, teaching aside, you are not for everybody, and that is okay. As long as you show up and you do your job, you're doing everything you're supposed to do. You cannot take it personal if a student doesn't like you. If a student is, not doing well in the class and you've done everything you can do not take it personal. Okay. It just is what it is. I had a student who she was very smart, but I could never correct her. Every time I tried to correct her, it was just and I could say it in the nicest way, like, this, that was good, but you could have did this a little. She would just go off. That was the first time I ever had an issue like that. In all the years I've been teaching, I started teaching in 2011. I had this student couple years ago. First time I ever experienced this, and I could not take it personal because I knew that I was doing what I needed to do. So when you're doing everything you need to do, don't take it personal. Okay. So again, time management, manage your time, plan it out, set your boundaries, reuse old lessons, make sure you're doing your self-care, and don't take student behavior personally. Now, I can't do this presentation without talking about growth because I'm very big on growth. If you've been following this channel for any amount of time, I'm always talking about growth and ways to make more money outside of medical assistant, as a medical assistant. So as an instructor, I got to talk about this. So some things you may want to look at is becoming a lead instructor. I was a lead instructor at my former school, as well as this school that I'm at now. Program director, you can kind of look at the requirements for that. Curriculum developer, online course creator, that's what I do now. Textbook author, YouTube educator is also what I do, and also consultant is also what I do. So look at some ways that you can use your skills to work up to these other careers. A lot of program directors started as instructors. I had a few instructors that I work with who ended up becoming program directors at different schools. So definitely look at that. Look at this list. Decide on something you may want to work your way into. If you need any advice about becoming a YouTube educator or course creator, you can always reach out to me. I have videos on that. And actually, speaking of that, I'll leave a link to the wait list. I'm actually starting a membership. So outside of medical assistant, I mentioned that I'm an entrepreneur. And so I'm starting a community, and I'm going to be teaching people how to, get into YouTube, course creation, and all of that. So I will also leave that link below this video as well for anybody who wants to sign up for that. So if I think of anything else, I'll do a part 2 to this video. This is it for now. Thank you for watching. Do me a favor and let me know down below. This was longer than what I expected. I wanted to get through this really quickly, but let me know if this was helpful. If you want to see more, make sure you subscribe. And also, I have an instructor starter checklist for you guys. You can download it. I'll leave that link below as well. I have the link on the screen, but it may be easier if you want to just click on it. If it's not clickable, you may have to just copy and paste it into the browser, but it's just a checklist that you can just use just to kind of make sure you're ready. Some of the things I didn't mention in this video that I wish I would have is on that checklist. Okay. All right. So yeah, let me know if this was helpful. Let me know down below. And thank you guys for watching. Be blessed.